know that face. It's good to see that face. Good morning, dear Dr. Rosensweet.
Ellen.
Uh-oh, you're kind of breaking up a little bit. All right, well, I'm just going to proceed.
All right.
And my one perception is, this is Dr. David Rosensweet. We have a lot of new women up here, and I briefly want to introduce you in this amazing man who I've been talking with for 3 years now is a doctor of... Yeah. Are you there?
Yes.
Okay. Doctor of 50 plus years, dealing with women in menopause for 25 plus years. We have the best here, and I am beyond grateful. And I know that many are. So that is my brief introduction, and we are going to get started with our questions. So thank you for being here. It's good to see you. Good morning. And always a good morning to everybody who comes up and sends in the questions and comments and so on and so forth. Again, a good morning. We start with question number 1, a question we get often, but an important one. So, number 1, does Dr. Rosensweet have insight into SHBG, meaning sex hormone binding globulin? Mine is way high above the normal range. It's disconcerting, and I'm not sure why this is. I'm not sure what mine is, like high or low exactly, but I know it's high, like way high, and I want to get it down. Is there any way to do that? Is there hope for me? Thank you.
Next question.
Okay, number 2.
There's hope for you. Sex hormone binding globulin, physiologic produce 4 different estrogens, progesterone today, fat soluble steroid. They around in the bloodstream, which is basically water. They have to be in some. You can't hear me, Carolyn? Can I start up again?
Me?
I'll start. I'll restart.
Bear with us, ladies and gentlemen. I believe that Dr. R is starting up again. I don't think I have to start up because we couldn't hear him. I know he's there, but he's somewhere in the ether. Yowza. Appreciate your patience. I don't have much to say this morning without Dr. R. Aw. Ay, ay, ay. So we're live. I don't know if I should restart or not. Hmm. So you get to stare at my beautiful face at 7 a.m. this morning. Not. Hmm. Oh my. I guess one day I'm going to put together a whole list of like Facebook Live bloopers. Maybe that'll keep everybody at least laughing if they're not feeling so well. Because trust me, I got them. I mean, all of this is live, so it is what it is. And I so appreciate your patience. I may have to reboot myself. If so, come back up, give it a few minutes, and I could sing you a song, I suppose. I guess the one thing that I would have to say to all of you that are out there, if you're out there, if you can hear me, is that, we do this weekly.
We are back.
I
Can you
see
hear me?
you.
Can you hear me now?
I can. You just keep talking, and then I'll let you know if you cut in and out.
Okay. Can you hear me
Yeah,
now?
I can, but you're cutting in and out.
I checked my speed is good. Good. I wonder if it's on your. You might need to reset. Carolyn.
I'm here, and I'm sure you can hear me. I'm just having a really hard time hearing you. Do you want me to reboot? Yeah. All right. I'm out. Coming back.
Is anyone in the chat? Tell me whether you hear me or not. Exciting my breakfast. Does anyone happen to be in the chat? Can you can you hear me? Oh,
Yeah.
Facebook users.
It's a mic thing.
I'm restream again.
Okay. God, you guys, thank you so much for bearing with us. This is like flying to the moon and back sometimes. It's crazy. Very, very appreciative of your patience. Oi. Right. I'm rebooting too.
How about now? Can, can you hear me?
I can.
Terrific.
So
You
far,
want,
so good. We've gotten 3 words in. It's really good.
and if
Shall
someone
I?
else could come into the chat and let us know if you can hear us both.
Well, we got one thumbs up.
Good. So, do you want to repeat that question, Carolyn?
I do indeed. So, welcome, Dr. Rosensweet, again. Thank you for your kind patience. Thank you, everyone, for your kind patience. Does Dr. Rosensweet have insight into high SHBG, meaning sex hormone binding globulin? Mine is way high above the normal range. I didn't get the ranges, and it is disconcerting. I'm not sure why this is. I'm not sure why mine is so high or how to get it down, or if I even should try to get it down. Thank you.
So, sex hormone binding globulin issues are number one, they're not a disease, they're not an illness. So, they're not something to worry about. And I want to explain what sex hormone binding globulin is. When the ovary secretes a hormone, and there's four of them: estrogen, progesterone, testosterone, and DHEA. These are fat soluble. They're not water soluble. So when they're placed into the bloodstream, as they are, they can't float around as fat globules like your salad dressing, oil on vinegar. It doesn't work in the bloodstream. They have fat globules floating around in there. But the body has a very super elegant mechanism, no problem. The body produces these proteins called binding proteins. And when the estrogen is secreted from the ovary, for example, it's picked up and bound to a binding protein. And that's how it's transported around the body and delivered to each cell. And there's several of these binding proteins. And one of the more popular ones is called sex hormone binding globulin.
Go figure.
Sex hormone binding globulin. There's others. And it tends to be present within a normal reference range because nothing in biology has exact numbers. We vary as individuals. So some women and men, because men have the sex hormone binding globulin as well for the testosterone and other hormones. Some women have this level of sex hormone binding globulin, metaphorically. Other women have this level of sex hormone binding globulin, and all women have something between there. And they're all healthy and they're all happy and everything works well, but there's a variation woman to woman. Now, you can get an elevated sex hormone binding globulin, and because sex hormone binding globulin has purposes, there's always a reason for that elevation. So let's say you take a young, healthy woman, 20 years old, and she goes on the birth control pill. This young woman is at the absolute maximum peak output of her estrogens and her other hormones that she'll ever do in her whole life. And now you're adding the birth control pill, which has extra estrogen in it. It has ethinyl estradiol, very potent estrogen. You can say low dose, huh? Where'd they get that name?
They got it mixed up.
The birth control pills have hormones powerful enough to prevent ovulation. No one can tell me that's called low dose. Well, it's lower than the original doses. Fair enough, but they're still plenty potent. So you have a young woman at the peak of her estrogen output and you're adding additional estrogen. What does her body do? It goes, oops, too much estrogen. Well, we have a way to protect against too much estrogen. We'll just increase the production of sex hormone binding globulin and bind up the excessive amount of estrogen.
May I ask, do you think that word bind is the scariest part of that whole sex hormone
I'm not
bind?
sure why. We could use another word like link up with the estrogen so that it could be transported around the body because it can't float free.
Yeah, right,
Very, very, very small percentage of it can float free. The blood cannot transport large fat globules around, and a
right.
lot of them. It can handle a small amount of free estradiol, but not much. Free testosterone, but not much. These are very low numbers. Most of the testosterone, most of the estrogen is bound or linked up or connected to, lovingly connect. I'm going to say it this way: the estrogen that comes out of the ovary and is lovingly connected to the sex hormone binding globulin and other plasma proteins and transported around the body where it's lovingly released when it comes to the target organs, which are everywhere.
So it's
How's
kind of
loving how's lovingly
lovingly
connected
wonderful.
to?
So it's kind of a protective device in a way?
Well, it's you cannot inject oil into a blood vessel.
Right.
You can even get something like there's certain fat soluble vitamins we'd like to inject intravenously, but we have to be super careful. Like you can't inject a whole bunch of CoQ10. It's fat. It's fatty. So you can't just do a whopping big IV injection of CoQ10. That's going to give you a big fat globule that could travel around in the lung and block a lung capillary. It's called an embolus.
Don't want to do
You
that.
can't have these fat globules traveling around. Well, the body has been pre-designed to have a different way to handle fat soluble stuff. It lovingly connects them to various plasma proteins. That's how sex hormone binding globulin really works. And if there's an excessive amount of estrogen for some reason, or an excessive amount of testosterone, as a protective mechanism against excessive amounts of hormones, the body is going to produce additional sex hormone binding globulin. And that's when someone's going to do a blood test and they're going to see elevated amounts of sex hormone binding globulin. What this woman did not tell us was how high was it.
She's going to
And
hear this, and I think I'm going to get this question this time.
yes, if you're listening, please tell us how high your sex hormone binding globulin actually was and what the particular laboratory reference range is for that sex hormone binding globulin. I haven't seen any super high sex hormone binding globulins. And again, even if they're high, this is not an illness. So we don't worry about it. What makes it high? Well, when someone goes on the birth control pill and they're getting some excessive amounts of estradiol, that sex hormone binding globulin is going to go up. And sex hormone binding globulin not only binds the estradiol on the birth control pill, it preferentially binds the testosterone in a woman. So there's some women who go on the birth control pill and they lose their libido because their testosterone gets bound up by that excessive sex hormone binding globulin. And let's say they stop the birth control pill. Well, it's quite natural to expect the sex hormone binding globulin to drop down and normalize. However, It doesn't do that all the time.
Right.
Sometimes once it goes up, it stays up. And I've seen women who have elevated sex hormone binding globulins, and I do a history to try and figure out what's making that go up. And it turns out that they took the birth control pill 30 years ago for 2 months, didn't tolerate it. And that was the only traceable cause. But it stayed up that long. A more common cause these days, or a common cause, is overdose on, for example, for women on ovarian hormones. They're taking too high a dose. They're getting injections that give these peaks of these hormones. They're raising their sex hormone binding globulin. So we pay attention to the sex hormone globulin, so much so that when someone does the menopause method or the bright method, when they show up to that first consultation and we ask them to bring all their blood tests that they've had that are recent. And if they do not have a sex hormone binding globulin, we'll give them a requisition to go get a sex hormone binding globulin. Because an elevated sex hormone binding globulin is common enough that we want to know about it right out of the gate. Now, when I see an elevated sex hormone binding globulin during that first consultation or soon thereafter, I don't go, oh my God, you've got an elevated sex hormone binding globulin.
I'd go
I
running
don't,
out of your
I
office.
don't know what to do.
I'd go running out of your office. Dr. Rosensweet saying that? No way.
I'll say something off the cuff like, oh, your sex hormone binding globulin is a little elevated, but we're just going to work with it. No, it's not an illness, no big problem. I make very light of it because even with an initial elevated sex hormone binding globulin, we can often proceed with the standard replenishing protocols for ovarian hormones. And what we'll discover is the sex hormone binding globulin never gets in the way. It never becomes a problem. We give additional hormones. Well, really, a woman's low, so we're just bringing her up near normal. And it doesn't elevate further. So it never is a problem. And that's why I'm so low key about it. Sometimes I'll see a sex hormone binding globulin that's more than just a little bit elevated. It's moderately elevated or it's very significantly elevated. My approach is always the same. Oh, so you got a little elevation there. We may have to deal with it, but we're not going to deal with it right now. I wait to see if she goes on a trial of replenishing the hormones, and if it doesn't elevate further, which is a decent likelihood. And then we recheck her, and how I'll know that it's not a problem is that she'll take the hormones and she'll do really well. And it'll be obvious that she's getting all the beneficial effects from proper hormone replenishing and nothing's interfering with nothing. Or that's probably not the proper way to say that.
It is.
Nothing is interfering with anything.
It's a Shakespearean term.
Yes, exactly. Thank you, Carolyn.
You're welcome.
And then occasionally, she's got an elevated sex hormone binding globulin. I've downplayed the significance, and we're having a challenge getting her balanced. And I'll redraw the sex hormone binding globulin because I'm smelling that it's an issue. And sure enough, it's elevated further. And then we have to do something about it if we're going to get hormonal balance. So there's ways that people have suggested over the years through nutritional supplements that'll bring it down. I've tried these. They haven't worked for me. I'm still looking for a, quote, more natural way to bring it down. Haven't found it. So much so that I've even forgotten which ones I've tried, and I've tried several. And but there is a pharmaceutical medication called danazol, and danazol is given to women who have endometriosis in rather high doses. If I remember correctly, something like 250 milligrams, maybe once or twice or three times a day.
Does one need a prescription for that?
Absolutely. And yet, women that we work with that we want to lower the sex hormone binding globulin, we might start with 12 and a half. We'll settle in somewhere over time with 6.25 to 12 and a half usually. So that's way low dose of danazol. We keep our eye on it. It's a medication. Every time you use a medication, there's possible adverse effects. We know what those are. They happen from time to time. But I'm taking danazol because I have a sex hormone binding globulin issue.
What? Well,
I'm a
how about
male.
that?
Males have sex hormone binding globulin issues as well.
And it's side note, lovely that we're accepting in so many. Not that we wouldn't have, but so many more men have come up, so they're getting this education too. It's beautiful.
So it works. It will lower that sex hormone binding globulin and keep it low. And so we just keep an eye on various blood tests to make sure that it's not affecting the white blood cell count, for example,
Right.
which it does rarely. I've been treating women and men for 28 years, and you see a lot of patients there. And I've seen one case of a white blood cell change in a male who was on, I think he was on 25 milligrams of danazol to get his SHBG down. So, yeah, sex hormone binding globulin, not an illness. It can be lowered. Sometimes we don't bother lowering it at all. So I would need to know this particular woman's numbers to get the significance of it. There is a
Yeah.
relationship, interestingly enough, to blood glucose regulation. People who have diabetes tend to have low sex hormone binding globulins, pre-diabetes, stuff like that. That's another story. We don't deal with that. We deal with the insulin resistance and the pre-diabetes. In most instances, as far as how it affects the hormones, is we're dealing with an elevated sex hormone binding globulin that so often it isn't a practical issue, even though it looks like the number is increased. But sometimes
Got
it is when we lower it with danazol.
got it. So I guess really the cap is that it's not dangerous.
Correct.
Because many women, including myself in the day, petrified by a high sex hormone binding globulin, but it's not dangerous. It is dealable with, and one can move on with his or her life and
Exactly.
feel better. Yeah. Thank you. Thank you. So, um, thank you all for being here and letting us know that you can hear us. um, Question number two, Dr. Rosensweet. On another group I visit, questioner says, I was told that only micronized compounded progesterone via a compounding pharmacy is effective. I use progesterone that my insurance pays for from my regular pharmacy. Is this an okay way to take progesterone, or am I possibly harming myself?
The progesterone you're taking is micronized progesterone, and its trade name is Prometrium, and it came along after the big shakeup of the Women's Health Initiative and the rising up of compounded hormones, and the pharmaceutical industry realized that they better start looking into um, things like actual progesterone rather than the progestins that they were offering. Big deal difference between a progestin, which is not progesterone, and progesterone. And micronized really refers to particle size. You need small particle size to get good absorption. The compounding pharmacists have been putting up progesterone in gels and creams, and now in our certified organic oils base. The compounding pharmacists have been preparing these topical progesterones for about since early 1980s. So that's about 40 years. And they're really good at it. And not only that, one of the many significant advantages of compounding pharmacies is you can individualize the dosages. Because let
Operative
me
word, yeah.
tell you, women are individuals. Oh, here's another news flash. Men are individuals too.
Oh no, I don't believe that. But
We
okay.
may we may look like males and females, and we may have many similarities, but we're in every measurable thing about us, we represent a range. And in the world of hormones, for example, we have done this for decades. Some women, I'm going to throw a number at you, they do really well on zero point 0.8 milligrams of estradiol equivalent per day. That's strength of estrogen. Whereas other women need 2.6 milligrams of estradiol equivalent to do okay. Wow. And everything in between.
That
That's 3 times. Some women need 3 times the amount of estrogen than other women do. And both of those women are perfectly normal. And that one woman needs 3 times the much of estrogen as the other one does to be normal. So we look like we're similar, but there's a wide range of biologic individuality. So along come these compounding pharmacies. They've only been with us for a couple thousand years because every pharmacist was a compounding pharmacist at one time.
my
That means
grandfather was.
that's great.
No, true.
Every one of them was. They took these herbs and these powders and these substances and they ground them up with a mortar and pestle and they put them in pill form or whatever form they were applying them. They mixed up these individual dosages. Then at a certain point, these individual pharmacists, along come these pharmaceutical manufacturers who took the common dosages that were being given, and they manufactured one or two or three of the common dosages. Not in any instance did they manufacture enough to address fully the individuality. There's a couple exceptions. They've done it with patches. They've done it with thyroid. They've got a lot of thyroid dosages. I'll sure give them that. But that's about it. They can't afford to do individualization. But some of this compounding pharmacists actually survived. And these are the happy pharmacists. These are the scientifically curious ones. They love making up these individual dosages. I know a lot of them, I want to tell you. And there's about 9,000 of them in the United States. Compounding pharmacists. They're some of the most delightful people. They love their profession and they just are ecstatic making up these individual dosages.
They're delightful people.
Women. And so, for example, when I determine that it's time to do a trial of oral estrogen. We always start out oral progesterone. We always start out with topical progesterone, but some women need oral progesterone. I asked my compounding pharmacist to make up 2 different bottles. One of the bottles, I say, put 30 capsules of 50 milligrams of micronized progesterone in there. And in the second bottle, put 30 capsules of 25 milligrams. Actually, I've come up with a new ritual that makes it even more efficient. I do 30 of the 25s and 30 of the 75s.
Oh,
And what I do is I'll start a woman on 50 milligrams, 2 of the 25s, for a night or two, and see how she does. And if she doesn't wake up groggy, in a couple of nights, I'll raise it from 50 milligrams to 75 milligrams, thus one 75 milligram capsule, and see how she does. And if she doesn't wake up the next morning with obvious symptoms of progesterone overdose, like being groggy, for example, for the next couple of nights, I'll take her up to 100 milligrams. Couple nights, see how she does. If she doesn't wake up the next morning groggy, I'll take her up to 125 milligrams using those 2 different bottles. And we keep on increasing until one morning she wakes up and she feels groggy, like she took an overdose of a sleeping pill. Progesterone's the great calmer. If you take too much of it, you get too calm. You get groggy. Then we back her down by 25 milligrams. So let's say she made it all the way up to 150, got groggy the next morning, we back her down to 125. I then asked the compounding pharmacist to make her up a batch of 125 milligram capsules. Why am I saying this? Because the range in my practice runs anywhere from 50 to 300 milligrams. And we always try and maximize progesterone for a lot of reasons. So think about it. If you go on 25 milligram dosages, that's a lot of different variations there. Well, the pharmaceutical manufacturers, they produce a micronized progesterone. It's called prometrium. They put it in peanut oil, some dyes in there. I don't understand how they're able to get away with that. There's people with peanut allergies, but they do. And there's 2 different dosage forms, 100 and 200. Well, that wouldn't serve for my practice because I have women anywhere from 50 to 300 milligrams. I want to fine tune it, and I want to balance it with the estrogen because
yeah.
it's very important that it gets balanced with the estrogen. However, so that my main objection is that you can't customize things with 100 milligrams and 200 milligram capsules alone. Nor do I want to see the peanut oil or the dyes that they put in there.
Right.
And if the only progesterone I had in the world was prometrium, you betcha I would prescribe
Yeah. Of course.
it. So you never say never. You know, there's a variety of um, there's a variety of quality possibilities in anything we want. We can go out there and buy the cheapest car possible, and it'll run for at least 50 miles.
If you made it.
Or you can buy a
Sorry.
brand new brand X that'll take you 300,000 miles, and you'll pay for it. It'll be electric, and you'll pay big bucks for it. And it's the quality is there in anything, and the good stuff costs more. But if
True.
prometrium was the only thing that I had available, I would definitely prescribe it.
So, many women who are using insurance can feel safe, at least, to be able to go
You
to
betcha they can, and
his
they
or
can
her pharmacy.
celebrate it.
Yeah.
Now, as I mentioned on Facebook before, um, we have a team, and my two business partners, Andre and Joshua, they began a project 3 years ago when Andre came on board to try and discover what's the barrier that women have to compounded bioidentical hormones, that there's not more women on them. And they quickly found out it was financial,
Yes.
and that women were paying an average of $240 a month. Some women were paying 150, others were paying over 300, depending on where you lived in this country. And that means that the access to compounded bioidenticals was in the hands of the wealthier women of this planet. And so leave it to Andre and Andre and Joshua, and they reached out, and it took us 2 years.
But you know what? I've been able to be a part of those 2 years and watch that, and it is brilliant. Brilliant, brilliant, brilliant.
And they eventually found a pharmacist that's licensed in 50 states, compounding pharmacist. And because we have providers using our method all over the country, this wonderful pharmacist said, well, listen, if you provide the volume, we can offer you a low price. So very soon, we're hoping within a month, could be two, you know how things move on the planet Earth. There's a lot of moving parts. We'll be able to offer to any woman all four ovarian hormones. And I'm pretty sure that includes oral progesterone, and the rest will be topical in our organic oils. All four ovarian hormones for $99 a month. If you get in on the ground floor. Otherwise, it's $119 a month.
Either
And
or, it's huge. I mean, it's amazing, and I've
yeah,
said it before, I will be the first one to put this out on blast, like, on every computer I can find.
and so this is the biggest breakthrough that I've seen in my rather lengthy career. And so, yeah, God willing, we're going to have this available fairly soon.
It's
Joshua and I
amazing.
visited this pharmacy in New Jersey, and we were really touched. This is a family-owned business, 100,
Oh,
177 employees.
oh,
The owner's a jewel. You can see why he was able to uh, build it so big, because of who he is. He's a quiet man, but strong.
watch
And
those silent types.
yeah, and he's a wonderful man. And we're everything, so that we're going to be able to really change the face of treating women in menopause because of
That's
that.
it. Yeah, thank you, Dr. Rosensweet. It's a matter of patience, and I get so many questions about the Bright program and um, biting my tongue, but you know me, and you
And
know
you'll
where
be
to
one of
find
the
me.
first to know.
Eh,
You'll be one of the first to know.
please. It
We'll
is
put it on
going
the
out there.
Facebook page among many other places that will announce it.
I'm gonna stand at Madison Square Garden with that big, you know, sign up there, right? Um, I appreciate the time that you take to answer these questions. I really do. Again, we've welcomed in many new women and many new men, which is impressive. And I'll move on to question number three. Um, Actually, I'm going to push it to four because this is a big one. I don't know where you went, but anyway, I hope you can hear me. Um, how does Dr. Rosensweet feel about taking estrogen and progesterone via injections? Also, how does he feel about taking estrogen orally? Many women love doing both, but There's a but. So we're wondering your thoughts on that or those.
My answer is, oh, really?
I'm
I
gonna write
have
that down.
I have never in my entire career met any human being that loves cold metal piercing their flesh from injection.
Yeah, or the bruising that comes with it. Oh,
So I don't find it common that people love to do that. They're willing to do that, and I appreciate that.
absolutely.
It's another one of those things. If that was the only tool I had, I would use it. But I have definite, strong objection to oral estrogen. And there's very specific reasons for that. Like when they first came out with the oral birth control pill, OCP, oral contraceptive pill. It was an uncommon but definitely happened complication that a certain percentage of women, I've seen a couple quotes, less than 5% or less than 1%, of these women developed thrombophlebitis, a blood clot in their legs. And a certain number of those women, that blood clot broke loose and went to their lungs and gave them something called a pulmonary embolus. That's a hospitalization and can be life-threatening. And the reason was that oral estrogen promotes blood coagulability. So, and the coagulation mechanism is very delicately balanced. We don't want to bleed too easily, or every little shaving cut, we would bleed nonstop. We want to be able to clot. We don't want to clot too easily, or we would have
Yeah,
life-threatening clots take place. We're delicately poised, and we want to be prepared for the rare event where we get hit by a javelin or bit by a saber-toothed tiger. We need to be able to clot then, but only then. And yet, it turns out Americans are overall hypercoagulable. We coagulate too easily. And there's reasons for that. It has to do with an excessive exposure to and mismanagement of germs. Because part of the primitive immune system is if you get a germ inside, you throw a clot around it. So germs provoke clots. We're hypercoagulable. Well, oral estrogen promotes coagulability. So there was a certain number of women who went on the birth control pill, they got clots. One of the reasons for this, when you take a steroid hormone, a fat-soluble hormone by mouth, it doesn't go right into the bloodstream. It goes from the intestine to the liver. And 80 to 90% of what goes to the liver immediately gets metabolized, gets biochemically processed and changed. And only about 10 to 20% makes it through the liver unchanged and thus functional. So it takes higher doses of estrogen to when you take it orally than when you take it other ways. So because of that thrombophlebitis and the hypercoagulability, and also the stimulation of the production of proteins, liver proteins, inflammatory proteins that oral estrogens do, we don't want to give it orally. Even though the number of people who get in trouble is low, they're still there. And if you're one of those people, that's a big deal. especially since when you apply estrogen topically to the skin, you don't get this increased coagulability. You never say never. Over the course of the years, I had 2 patients that I suspected had it topically, but they eventually adjusted. But it put me on red alert that if someone's got a coagulation story, that means when I'm taking their medical history, they had an aunt who died of a stroke, or a mom who died of a heart attack, or they had a blood clot in their legs when they were younger, or they have a hereditary hypercoagulable state like a factor V Leiden or something like that. We really pay attention to those things, and we don't administer hormones until we've evaluated their coagulation system to make sure they're not sitting in a hypercoagulable state before we're giving them hormones. So this is part of our training program. There's a whole section on blood coagulability. This is a big subject. But oral estrogens, forget about it. Topical estrogens, they work wonderful. How do I know? Because I've given it to hundreds and hundreds and hundreds of women, and I've seen their 24-hour urine hormone tests, and I've seen them say to me, gee, I feel better once they start the hormones, so it's sort of pretty obvious. No
Right.
reason in the world to give a woman oral estrogens. Injection, I'm not a fan of injections. You inject it and you get this immediate high peak. What does the body do with that? Sometimes it will increase the sex hormone binding globulin just because you produced a high peak. We don't like high peaks. We like the nice, slow, gradual thing that applying something to the skin does. The peak is much lower, so it doesn't provoke things. Like it doesn't provoke a sex hormone binding globulin elevated response that we talked about at the beginning of our time together today. So I'm absolutely not a fan of injectable hormones at all, or oral hormones. Now, oral progesterone is an exception. Women can do really well with oral progesterone, no problem. And they can also do really well with oral DHEA. There's a
But
little bit
not
of
above a certain amount, right?
well, yeah, you don't want to give a woman too much DHEA. In fact, a woman should not be taking more than 15, as in teen, 15 milligrams of oral DHEA. Should not go above 15.
I raise that because often I see just at local stores or whatever 50 milligrams,
Yes,
milligrams.
it's an accident waiting to happen.
Yeah. So
And I think it's a setup that I don't want to go into the politics of this, but it should never be allowed. And people don't know what they're doing, so you know, still a very primitive time in human history, and crap's happening all over the place. In case you haven't noticed, Carolyn Shapiro,
put that one in my notebook and put it under the desk.
take note.
Take
Crap is
note.
still happening around here.
It's true. I mean, they're out. It's out. Oy vey. Sorry. It is out there, and it's scary, and that's why we have doctors like you who guide us and help us and teach us and get us through safely and help us feel better. Thank you so much.
You're welcome so much.
We started a little late. Do I get 2 more minutes?
No,
Yeah.
I'm sorry. I've got other commitments this morning.
Oh, go figure. Dr. Rosensweet, thank you so much. I will keep these last 2 questions for next week.
All right.
It's wonderful to see you. It's wonderful to have everybody up. I know what I'm going to be expecting when I get off of this Facebook Live. Your time is always so, so, so appreciated. It is. And good to see you. I wish everybody a really, really nice week, safe week, happy week, hopeful week.
Thank you,
I don't know.
Carolyn.
I don't know what else positive to say other
Yeah.
than that.
Thank
And
you very much, Carolyn.
thank you,
I'll
Dr.
see you
Rosen.
next week.
We will see you next week. We will take the questions, send them in. I got them. And I'll say adios for today.